Refractive surgeries are elective procedures performed to correct refractive errors such as myopia, hyperopia, and astigmatism by reshaping the cornea. This changes the major optical function of the eye and carries some risk. These surgeries do not stop the natural aging process. A patient who has LASIK at age 40 may still need reading glasses later. If the surgery is performed to meet occupational vision requirements, such as for a pilot or law enforcement officer, both the patient and the employer must be satisfied with the results. No surgeon can guarantee perfect vision. Preoperative considerations. The cornea must be structurally normal, and the refractive error must be stable. Contact lenses should be discontinued before surgery, 2 to 3 weeks for soft lenses and 4 weeks for hard lenses, to allow the cornea to return to its natural shape for accurate measurements. Patients are not good candidates if they have poor wound healing potential, such as those using chronic corticosteroids, those who are immunosuppressed, or those with elevated intraocular pressure. Untreated superficial eye disease must be addressed before surgery. Patient education is essential. This includes counseling on risks, possible complications, and the need for follow-up care. Postoperative care usually involves topical corticosteroid or NSAID drops along with an antibiotic. Photorefractive keratectomy, PRK. PRK treats myopia or hyperopia with or without astigmatism. The excimer laser is applied directly to the cornea based on precise measurements. For myopia, the curvature is decreased. For hyperopia, the curvature is increased. A bandage contact lens is placed after the procedure to promote healing and reduce discomfort. Laser-assisted in situ keratomileusis, LASIK. LASIK involves creating a flap in the cornea to access the stromal layer underneath. A microkeratome cuts a flap less than 1/3 the thickness of a human hair. The flap is folded back, the excimer laser reshapes the stroma, and the flap is replaced. There is no conclusive evidence that LASIK is superior to PRK for nearsightedness. Both have relatively few complications. Perioperative complications. Possible surgically induced abnormalities after LASIK include central islands, decentered ablations, and irregular astigmatism. Symptoms may include monocular double vision, ghost images, halos, glare, and decreased visual acuity. Hasher phakic intraocular lenses. Phakic IOL implantation is an option for moderate to severe myopia. These lenses can be placed in the anterior or posterior chamber. The patient's natural lens remains in place, the cornea is preserved, and the procedure is reversible. Vision outcomes are often more predictable than with corneal reshaping. Potential complications include cataract formation, iritis or uveitis, endothelial cell loss, and increased intraocular pressure. Conductive keratoplasty. Conductive keratoplasty is used for low to mild hyperopia. It applies radiofrequency current to the peripheral cornea with a handheld probe. This reshapes the cornea without removing tissue. Summary. Refractive surgeries can be life-changing. However, patient selection, education, and diligent follow-up care are just as important as the surgical technique itself.